Basically, just in skin of color, because of these risks and because you want to provide the best result and outcome for your patient, you kind of need to treat them a little bit differently compared to some other skin types.
Welcome to the Derm Cafe. Here you will learn about the latest cutting-edge dermatology treatments and procedures from skin experts around the world. Now, on to today's Dermcast with your host, board-certified dermatologist and Mohs surgeon, Dr. David Harvey.
Hey, and welcome to this episode of the Derm Cafe. I'm your host, Dr. Dave Harvey, and with me today, I have the privilege to introduce Mallory von Lotten. Mallory is a second-year medical student at the University of Alabama Birmingham, and it's great to have you here at the Derm Cafe. How are you doing?
Good. Thank you for having me. I'm excited.
So you're a second-year medical student, and just tell us a little bit about yourself and how things are going in Alabama, in Birmingham.
Yeah, so I am actually about to start my second year of medical school on Monday. So it's a little nerve-wracking, but I'm really excited. But a little bit about me. I am 24 years old now. I grew up here in Peachtree City, Georgia. I went to Woodward Academy for high school and then went and started at LSU for undergrad, and I graduated in 2021. And immediately after I graduated from undergrad, I was accepted into a master's program, a one-year master's in biomedical and health sciences at UAB. So about a month after graduating undergrad, I went back to school, did a one-year's master's program that actually allowed me to enter directly into medical school the following year, as long as I maintained a steady GPA and things like that. So I then started my first year in medical school last year, finished up this year, and I'm on a nice little break, and I'm about to get started again.
Yeah, well-deserved break, I would say, from all you've had to go through. That's a lot. I mean, you did probably 20 years of education in almost year or 5, and I started at LSU, great school, and what a effort to be put in. Now, tell me a little bit about your decision. Obviously, you went to LSU. I think you have family member as a physician, but tell me like what actually influenced you to maybe pursue medicine or a science field? Can you tell me a little bit about that?
Yeah, so I feel like growing up, what really got me interested in the field of medicine and in science in general, I was just really excited to learn about that in school. So me becoming interested in pursuing a field of medicine wasn't really far off from me, because I was always knew that I had a primary interest in biology. I was just always so interested in the body and anatomy and things like that. But I do feel like what really influenced me also was my parents. I feel like early on as a child, they really instilled in me the drive to really want to do well, not only in school, but kind of in everything that I did in life. So not only did I feel like it was a need for me to really do well in school, but it kind of became a want for me. And I feel like not a lot of other students really are as invested in education as I was. And I think that still kind of plays a role in why I'm so interested in education now and why I enjoy my time as a medical student and learning and things like that.
Yeah, that's so wonderful. I mean, having your parents being such good role models and putting the effort into supporting you and taking the time to encourage you and lifting you up when you weren't feeling good and things, that plays such a role. And you are really, really blessed to have such great parents. And to those people out there that do, I mean, you should thank them every day. They do a lot behind the scenes, and now they love you. And usually it's something that they just do because that's what their heart's led to. But wonderful story there. And in terms of your pursuits, tell me a little bit of some of the things you've seen, and like, for example, some of the challenges you've felt. Like, how did medical school, once you got in, because obviously you kind of went through a track that was predetermined, how was it meeting the needs you thought you'd have to go through, or was not? Like, what were the discrepancies of that? Can you just elaborate on that a little bit?
When I first started medical school, I had no idea what to expect. And I feel like a lot of students probably feel that same way coming straight out of undergraduate, which is why I personally feel like the one-year master's program was really, really helpful for me, especially since it was at the same medical school I'm going to now. I took a lot of the same classes. I took a lot of the same professors. So in general, that was very helpful for me. But entering medical school, it's still such a challenge. It was definitely a struggle kind of adjusting to the speed of the courses. You're learning so much information in about 5 weeks and have such difficult exams, and it's just not a lot of time to get things done. You just really have to adjust your study strategies. You can't really study the same way you might have used to in high school or in college. It's a lot more. But what I did realize is that UAB, and I'm sure a lot of other medical schools in the country, they have a lot of resources where they really want you and try to help you succeed. For me, I've gotten involved in small study groups, large study groups. They have tutoring, counseling. I study with friends. I feel like all of that kind of made it easier for me to adjust and perform well in medical school.
Yeah, it's a village, You're going through this path, and maybe your path's a little different than somebody else, but you work together. I found that was what my experience was too. College and high school on steroids, just so much volume, and you're constantly moving, and it's almost like a marathon because you have to just keep going, and then you get a tiny bit of a break. The study groups are phenomenal. And having time, do you have time? So when you do have free time, tell me a little bit about what you do in those snippets of time. What do you do for those times where you have some free time?
So I really, really, really appreciate my free time because I don't get a lot of it. And it's very easy to get overwhelmed and kind of burnt out in medical school because you're just studying. You feel like you're studying all of the time. Emphasizing that importance on my mental health and taking that time to myself to say, okay, I mentally cannot study anymore. I'm going to watch my favorite show, which is The Office. I watch a 20-minute episode and it will make me feel so much better. Yeah. But yeah, I think really emphasizing and recognizing that studying is, and yes, it's important in medical school, but also being mentally healthy and taking the time that you need for yourself. I think that's super important.
Yeah. Just to regroup and to refresh and get back with more energy. And when I was in school, we had a lot of fun times. We would play racquetball. That was really popular in the 80s when I was in school. And then singing in a cappella. We had various groups that would sing. And then every Friday we used to have a happy hour type thing where we would meet and just group up and have a few beers and chill. So it just having that little bit of time. Tell me some of the things you didn't expect about medical school. Was there anything that you felt like it was more put off-ish now? I know there's a lot more with social media now today and things like that. Tell me about some of those thoughts. Do you have any on that end?
I would say things that I didn't really expect about medical school. I didn't expect everybody, especially I'd say my class as a whole is about 200 something people in my class. I wasn't expecting everybody to be so helpful and want to help each other succeed. I feel like in other schools, I know I have friends in law school and things like that, and they say all of the students are just so competitive. They're not helpful with one another. So I wasn't really sure what to expect in medical school, but now that I'm here, I'm realizing that everybody just wants to pass and do well. So we all kind of just support each other and send resources. And yeah, so that was a pleasant surprise.
Yeah. So I mean, when I went to school, I had sort of the same thing, but we weren't as always supportive of one another. There were a lot of people that were cliquish and maybe we're holding back and some drama at times. So I'm glad you don't have to see so much of that, but it's just, I think it's such a hard road that it's so nice to be in a situation, an environment where you can lean on somebody and not feel like you're maybe they're going to take advantage of you or use you in some way. So that's great. So before we go to break, I just have one more question. And that was, you've been through this path, very condensed, hardworking, very successful, doing great there. So for others who might want to follow your path, do you have any advice that you might want to give to them? Maybe a high school student or somebody in their first year of college might be thinking of pursuing a career in medicine. Any advice you can give them?
Yeah. The first thing I'd say is really just don't give up. The path to medicine is super complicated and super challenging, but my dad always told me that if it was easy, then everybody would do it. And I think that's something that really kind of kept this drive in me. And if it's something that you really, really want to do, if you feel like it's really your passion, then you'll get there. So just don't give up, push through the application process. It's all worth it at the end.
Awesome advice. Well, Mallory, great talking to you on the first aspect of our Derm Cafe podcast. We're going to go to break now, and then we'll come back and talk about your project. Sounds really exciting on acne, scarring, and skin of color. Stay tuned.
I'm excited.
Hey, Dr. Harvey, we're here for the second part of our podcast here with Mallory von Lotten, a second-year medical student from the University of Alabama Birmingham. I understand you've been doing some really interesting research on acne scarring and skin of color. How did you come up with this project?
I kind of already know that I'm interested in pursuing a field in dermatology, and I really do have a focus on patients of skin of color. So I knew that I wanted to kind of research something in that alley. As a patient of skin of color myself, who has dealt with post-acne scarring and hyperpigmentation and things like that, I think that's what really sparked the interest in me kind of wanting to dig into it a little bit deeper and just kind of know more about it myself. Hopefully, the results of my research can go on to help other patients with skin of color too.
Yeah, so it's kind of a personal thing and just what you've been through as a teenager. I find that so impactful. You know, when you have to go through an ailment, whether it's eczema or acne or psoriasis, you know, it plays on you, and then to take that personal trauma and made that positive so you can help others and can glean insights is great. Tell me a little bit about specifically acne scarring. You had some questions. I think that I was your mentor on this, but we talked about this, that you sent out to board certified dermatologists. Tell me how you came up with some of the survey questions.
My goal for this research project, I kind of wanted to serve the community more than it serves kind of the physicians and things like that. So I wanted to think about what factors really come into play for real life patients when they are trying to figure out what treatment modality works best for them. So I wanted to ask questions in the survey that kind of reflected what patients would want to know for themselves going into picking out the right choice for their treatment. So that's kind of why I asked about how many recurrent office visits do they have? What's the price of the treatment? What is the safety for patients in skin of color? I really ultimately want this survey to just more so be helpful for patients of skin of color in general so that they can kind of pick the right choice for them.
Let's talk about acne scarring a little bit in depth for the audience, just to educate them. So what have you learned? And I can pop up a slide here on the different types. Do you mind talking about that just briefly, and I can fill in too, but just tell us a little bit about acne scar types?
For sure. So there's different types of acne scarring. There's ice pick, there's rolling, there's boxcar, and I chose to focus mine on boxcar scarring because I realized that I see that a lot in the community just from friends and just people that I know and just interacting with other people. I've noticed that I've seen a lot more boxcar scars. And doing my research, I found that they comprise about 20 to 30% of scars, and they kind of present with like a wider spherical depression. So that's boxcar scarring. And I didn't really focus more so on the other types of scarring, just more so on the treatments that you would use. So for my survey specifically, I asked the board certified dermatologist which treatment modality they would prefer out of CO2 laser therapy, radiofrequency microneedling, TCA cross, and subcision. And I also gave them the option to kind of put in if they had another option or treatment modality that they use.
Yeah, there's a lot of options out there. I think this is really a very poignant approach because, you know, you're going to get a whole spectrum of answers, but it's nice to see what the consensus would be. As we know, different skin types and in skin of color, it has its advantages, obviously, and disadvantages. For acne scarring, what do you think some of the difficulties might be for patients, and what should they be aware of as a risk for having treatments?
I think in patients of skin of color, what some dermatologists and health professionals might not understand is that you kind of have to treat different skin types differently. Definitely in darker skin types, it's much, much easier to scar. So typical treatment types like microneedling or TCA cross, I noticed that in my survey, a lot of dermatologists did not choose to use that treatment on skin of color, primarily because of the hyper or hypopigmentation effects of the treatment. Basically, just in skin of color, because of these risks and because you want to provide the best result and outcome for your patient, you kind of need to treat them a little bit differently compared to some other skin types. So I think it's just important to recognize that.
Totally understand. I agree with that. You know, as a practicing surgical dermatologist, it's always difficult for people because everybody's going to respond differently. And you mentioned the pigmentation issue, and that's just the case, just like in skin of non-color or my type skin, type 2 Fitzpatrick, we call it. I'm going to have a lot of redness probably after treatment. One of the things we usually like to do is a test spot with whatever modality, because we want to see, is it going to be effective? So you don't waste the patient's money if it's not, or partially. So at least you just say, well, you might need multiple treatments. And if you do have an adverse reaction, it's limited and you can treat it as opposed to treating the whole face. So it's always good to do a test spot. The other thing that I found, and just to disclose, is like if somebody's prone to keloids, their response to injury is more kind of unanticipated, that might be also somebody you're more cautious with. But there are some advantages of skin of color treatments too. Can you talk about that relevant to these modalities of therapy?
Yeah, so I did want to mention that in general, in the field of dermatology and really in medicine in general, a lot of research and a lot of knowledge on different diseases and disorders are not fully known in like African Americans and patients of skin of color. That can also play a role in misdiagnosing and things like that, because one disease might look completely different in a different skin type. So I'm actually working on another project where we take photos of patients. We get their consent. We take photos of different diseases in different skin types, and we upload them to a website for physicians and medical students to use, just to kind of decipher, okay, how does this look different in this skin type? So I think that can also be an advantage when you're treating skin of color, because I really think, other than making the patient feel really confident and comfortable in their skin, I feel like it plays a big role in education as well. Because I think that, I feel like several dermatologists and people in the healthcare field might not understand the importance and the differences of different skin types and what different diseases look like in different skin types. So I think if we're able to kind of spread more knowledge on this and effectively treat more patients of color, I think we'll ultimately be able to improve like physician knowledge and patient satisfaction in the future.
Yeah, such a good point. I mean, because you have masquerading disorders all the time, and what somebody might think is acne scarring might be some other infection or weird modality that you're not thinking about, and so the whole treatment program is going to be different than just bringing out a laser or doing some filler. So wonderful point. That's and we all can learn more, and we are every day. So I hope that project goes really well. So tell me what's next for you, Mallory. You're going to be a third year, so I presume this is going into the hospital clinics now. Tell me what you're looking forward to going forward.
I'm actually starting my second year, and I start the third year probably around March. It's a little nerve-wracking, especially having to go in and take the step 1 exam and all of the preparation that's going to have to go into that. But I am excited ultimately, and I think working in the hospital, I've heard that our third and fourth years really prefer that than being in the classroom all the time. So I'm actually really excited. Obviously, it's going to be a challenge, but I feel like I've done it before. Gotten through my first year. I think in my second year should be hopefully a repeat of that. But otherwise, I'm excited to continue my education, get into more research, and then obviously eventually attach into dermatology.
Yeah, absolutely. You've got a bright career, and congratulations on all you've done, and thank you for being a part of this communal effort to help patients with skin of color with acne scarring. It's great. Well, on that note, I think we'll end the podcast today, but thank you for joining us and presenting your knowledge, and we really enjoyed it. We'll look forward to hopefully having you on again.
Sounds good. Thank you for having me.
Thanks for listening to this episode of the Derm Cafe. We hope that you have learned some useful tips from today's Dermcast. Tune in next time as we explore another exciting healthy skin topic. Until then, be good to yourself and your skin.